At what point did you realize that you had traumas from your childhood that you need to heal?
So I first realized it when I got into treatment, and realized that I had a lot of abandonment issues and thinking that I wasn't good enough.
Okay.
And so working it out with one of my counselors, we had a wonderful African American counselor. Her name was Cassandra. And she helped me to realize that I had mother wounds. That was
Mhm.
probably the first time I really recognized that. And so we had a long night of processing one night, and that was the first time that I realized. And then as I got older, being a woman, I realized I could see why any woman would have any challenges at the age of between 17 and 24. And so I began to give her a little bit of grace, because I was going through my own struggle. So I could totally relate to her, you know.
I look at my parents now that I'm in my 50s, and I'm like, they were just figuring things out too. Like, they didn't know what they were doing. So, kind of
Yeah,
puts it all in perspective.
yes, definitely, definitely. Yeah.
So, were there any other traumas that happened to you growing up, or was there anything else that caused you to turn to drugs? Or
Yeah, I mean, abusive relationships, yeah, mainly just abandonment, and
Mhm.
always being afraid that I was going to be abandoned again.
Okay.
And that was all the way just up into the age of 20, like I said, 21, 22 when I entered treatment. Life changed totally after going into treatment and finding value in myself and wanting to stay clean and sober. I had a wonderful therapist that helped me to navigate life. I chose not to do the NA and AA route because I was very young. And if I ever did relapse, what was going to happen is I was just going to have more ways to be sick. And
Mhm.
so, through my spiritual practice and through my beautiful therapist, I was able to navigate my challenges just by, talking it through. And, I had this split because when I got into recovery, which was like 30 years ago, you could talk about it to anybody. So if I had divulged to anybody on my job, I would have never been promoted. I wouldn't
Right.
have never made it anywhere near where I did when I retired. I was administrator for in the Office of Neighborhood Safety, and I would have never got there because people would have been judging me. I watched them
They would
do
have
it to me,
frowned upon your revelation.
frowned upon
Yep.
me. Now it's not so like that, but back then it was just like taboo. And now that I'm older, I can see many women are still struggling inside of trying to be in a space that really doesn't really work or fit for them. So about age 44, which was about 8, 9 years ago, I did a program called Landmark Worldwide, which helped me to merge the two. So for me to even be able to sit here today and tell you I use cocaine, that is huge for me because my life was so split
Mhm.
with shame and guilt. I had to reconcile, like, I wouldn't be where I am today or who I am today if I didn't have that lifestyle.
It's part of your story, definitely.
It's part of my story.
And I would imagine the abandonment issues manifested in relationships with men as well, I would imagine.
Yes, very much so. Very much so. So I've managed, if I can't control the relationship, I usually am not in it.
Right.
And so that's something that I had to reconcile with about 8 years ago, is letting go of my control of many things, not just relationships, but you know, being a codependent in other people's lives. Seeing, I'm also, I can see things. I'm empathic. I read energy, and so I had to learn to just like, that's not, just because I know it doesn't mean I have to speak on it, doesn't mean I have to be in action. It's just that I know it. And if someone comes and asks me, now I give it to you. Before I was in everybody's mix. I
Oh,
could I
yeah.
could fix everything because I've had so many life experiences and I wanted to just give it away. I wanted everybody to be healed in the
Mhm.
way that I was healed. But at times that just can't happen.
Yeah, they're
You
not
gotta
a lot of people aren't even ready to be healed or hear the information that you probably have to share with them.
I had to come to that conclusion. They
Mhm.
want to hear it, but they're not ready to get in action about anything to change their lives.